course, you're very intelligent and a friendly person. So it's my biggest honor to interview you. And so, Doctor, as a professional psychologist, how do you apply the Buddhism, especially its psychologists, Buddhist psychologist teaching to your clinic patients?
So actually, as far as the early Buddhist, the psychological points are concerned, I see that those psychological points are so relevant to even this modern context. For example, when we just look at some suttas of the early Buddhist teaching, just like Raga Sutta of the Anguttara Nikaya. In that sutta, our Buddha very clearly explains that there are two types of illnesses. One is physical and other one is the psychological illnesses. And that context, Buddha has very clearly explained that his one of objective is to resolve that sort of psychological illness and so on. So I suppose 2600 years ago, Buddha has very cleanly and distinctly cleanly and very comprehensively understood that sort of the mental illnesses and abnormal behaviors very keenly. So I suppose that from that point of view, if the Buddha has very cleverly understood that the mental disorders and abnormal behaviors, so with the help of the Buddhist psychological principles, I suppose that we can apply those teachings to resolve modern problems too.
So, as we all know, there are so many books or the reports are concerning on this psychological problem, especially the Buddhism's engagement in the psychologist treatment, the psychological problem treatment. So most of them are maybe generally speaking, averagely they just promoting some meditation techniques as approaches to heal, to cure or treat the bad emotions or distress like the high pressures and other mental disorders. So do you also use meditative technique to treat your patients?
Actually, the most probably when we just look at the Buddhist, the psychological context which are related to this field, first of all we have to clearly understand what our limitation is. Most probably I see that Buddhism has discussed mental disorders and abnormal behaviors which are caused by psychological background, or you can say that due to noxious trio, desire, hatred and delusion. And other way around, Buddhism just look at some sort of the psychological and physiological interconnection. So but Buddha has most probably concerned the mental illnesses and psychological disorders which are caused by psychological background. So if we understand that aspect clearly, so then we can use not only the meditation but also other aspects. So for example, we see that sila. So I suppose from my practices, sila, the Buddha's teaching, just like sila of morality, can be used to transform the people's, the behavior. For example, we can say behavioral transformation. So when we just look at the samadhi or concentration, so we can use that psychological points to develop the people mental development. And we just look at the panya. I see that if you know that aspects will, so we can use that teachings as the cognitive transformation. So as you ask, not only the meditation, so we have some sort of behavioral transformation and psychoanalysis. Most probably when we just look at the Buddhist metaphysics or the Abhidhamma, so that's I see that's just like the psychoanalysis method. So then not only the meditation, so no doubt that we can use the meditation, but in other way around, behavioral transformation and mental development, psychoanalysis approaches. So if you know such elements comprehensively, so with the help of meditation we can come up with a very good Buddhist psychological principles which are related to counseling and psychotherapy.
So maybe if I'm not wrong, so besides the meditation, we can use the behavior transformation through the sila practice, and we also can do to guide the patients to do the psychological analysis, and also as you just mentioned, you also through some approach such as mental development.
So Venerable, the most important thing is that I suppose that the suttas, the most relevant psychological points of the suttas are based on the subconscious levels of the individual. So there are no doubt that most suttas even deal with some unconscious level, but most probably when we just go through such suttas clearly, we see that they are so relevant to discuss the subconscious level. But when we just look at the Vinaya Pitaka, we see that they most of the time talk about some sort of the conscious level. And when we just look at the Abhidhamma, we see that Abhidhamma most probably related to discuss the unconscious level. So the latent level, just like Anusaya, Paritthana and Vitikam. So I suppose that the thing is that when we just relate all those teachings, not only with the suttas, Vinaya and Abhidhamma, when we just come to some later explanation, just like Jataka stories and so on. For example, I just look at the Dharimukha Jataka. In that Dharimukha Jataka, our later, the Buddhist scholars, they have concerning all the psychological aspects in entire Buddhism, they have concluded them into a very specific level. So they explain that there are some mental disorders and abnormal behaviors caused by, their desire. So they concern it as a kama unmada. Kama means desire, unmada means mental illnesses. So due to hate, they explain them as dosa unmada, due to hatred and so on. And if there are some sort of parapsychological, so they explain it as the yakshonmada, possessions of devils and so on. If there are some mental disorders and abnormal behaviors caused by some sort of, the drugs or something like that, the sura unmada, and some sort of, due to social collapse and so on, Vesana destruction, Vesana unmada and so on. See how Buddhism has discussed these mental disorders and abnormal behaviors in a very comprehensive manner. So as you just asked earlier, I suppose that meditation is only one aspect, but rather than concerning other aspects also, we have so many approaches. For example, when we just look at the Sabbhasa Sutta of the Majjhima Nikaya, Sabbha means soul, Asa means canker, how to eliminate all the canker. It explains 7 approaches to eliminate mental disorders and abnormal behavior. Meditation is mental karma. It's only one aspect. Apart from this meditation, there are other 7.
Yeah, there are several.
So it's a very in a sense it's a very comprehensive the explanation.
Thank you, Doctor. Okay. Now let's move to the second, also the last question. Yeah. Okay. The Buddhism, the Buddhism always teaching the followers uprooting the cause of the conflicts or the sufferings to solve the problem. According to your research, what's the biggest psychological change of the persons who will fall in the conflicts or who will get involved in the conflict? So, in short, it means the one who get involved in the conflicts. What kind of changes in what kind of changes maybe in his psychological activities will make the people easily to fall in the conflicts?
Yes, Venerable, your question is very clear. So I would like to just get some the explanation from the suttas. For example, when we just look at the Samyutta Nikaya Jata Sutta, it's explained 2 kinds of conflict, Antojata, Bahijata, the conflicts which are caused by the psychological issues and the conflicts which are caused by the sociological background. see that Buddhism has understood that there are two kinds of conflicts which are caused by psychological and sociological. For example, it says that according to Buddhism, anyhow, rather the conflicts which are caused by psychological or sociological, anyhow, finally the conflicts actually creates in the mind. The world is within this fathom-long body. So then Buddhism most probably concerns that if you want to really eradicate these sort of conflicts, firstly we have to give the fire to the mind. So in the Buddhism, it most probably has explained very clearly if there are some the conflicts which are caused by the desire we have some the approaches. So we have to eliminate the desire. So then the desirelessness, the aspects. If it is so, for example, the hatred, no doubt that so the metta is the most important, loving kindness most important thing, and the delusion then most probably we have to provide the knowledge. So theoretically we can come up with the most probably very the very big deal with some sort of theoretical points of view. But personally I see that so there are so huge suttas and so on, Theravada, Mahayana, Vajrayana. No doubt that we can come up with many theoretical points of view, but most probably important thing is that how I just understand and how I just come up with some sort of practical program. So I would like to add from my practical points of view. So I have introduced some sort of the program in Sri Lanka, the ME in Buddhist counseling. So very recently I introduced another ME course to Thailand University Korat. So for example, that is also in ME in Buddhist psychology and so on. Then so I introduced another new program to the Penang, and very recently actually I just came from Singapore. So I introduced a certificate course in the Buddhist counseling. So I think that we are all Buddhist scholars, I suppose, regarding our Buddhist universities and so on. So we have so many gems, we have so many theoretical points. But the thing is that according to the social context, according to the background, it is better to just come up with some sort of, as you mentioned earlier, the principles of engaged Buddhism. So this is the engaged Buddhism, this is the practical Buddhism. So I hope to introduce some very important program in Sri Lanka with the combination of cancer hospital in Maharagama. So I would like to introduce my students, ME students, those who have just completed, just as a Buddhist counselors, those who can just treat, those who can just provide their counseling to terminally ill cancer patients. So in this way I suppose that as Buddhist scholars from this point of view, even though we have many kinds of theoretical programs and the other aspects, now time has already come to just come up with our own theoretical practical program in accordance with the context which is related to the economical, social background and so on.
Yeah, so I'm so happy to hear you are doing a lot of programs to counseling the psychological welfare of the people.
Yeah.
The only problem is right now the high competition in the society, and there are a lot of things happening, and now the psychologists will be more and more, even the Buddhist monk. Actually, even at the ancient time, they already acted as a psychologist to treat some problems, some people who come to counseling with them. So I'm very happy you do a lot of good programs to benefit the society. I'm very much appreciate your kindly accepting our interview and your suggestion and your ideas is very constructive. Thank you so much.
Okay.
Thank you.